Hello everyone, I am Dr. Vannala Raju, consultant pediatrician at Virinchi People's Hospital, Banjara Hills, and
I'm Dr. K. Venkata Vijay. I'm a consultant Cardio Thoracic Surgeon at Virinchi People's Hospital. Hello everybody.
today we are live to discuss regarding the hole in a child's heart, that is septal defects, which we commonly call it as, or people know it as a hole in the heart. And we have asked for questions, those who have doubts, or some users that they have any child or anyone with a hole in the heart, that is septal defects, to connect. So we have a parental group. So some of the parents, they have asked a few questions, sir. So we will take one by one, and along with that, we are live on YouTube and Insta also. We will be receiving all the questions that we receive over YouTube and Instagram, and we'll be clarifying on that. So, sir, we have a question. One parent was asking, hello, sir. We found out on 2D echo that our newborn baby, currently 4 days old, has a small VSD, is what the doctor said. And doctor said it might close on its own, and we are a little worried to just wait without doing any treatment at this point. How long should we wait before deciding on further action? Basically the newborns, they have small ventricular septal defects, which is quite normal. So we need not just jump into treating the small ventricular septal defects, because that is actually normal, and many of these ventricular septal defects, they spontaneously close without any intervention. So especially things like muscular VSDs and small VSDs, they do close on their own. There is no need to worry on this. And if we screen everyone, like all the babies, in many babies we may find these ventricular septal defects, and not all the babies required to be treated. So I am sure that your doctor must have clinically assessed the baby, and that is the reason why they have asked for wait and watch. And based on their periodic assessment of the baby, their heart status, and if required 2D echo scannings, they will help in telling us whether to intervene for this VSD, or we can wait and watch.
Normally we wait until 6 months to 1 year comfortably, and if they are not closing by 1 year, then there are less likely chances of closing that VSD. But is it really small? Is it restrictive? Is it a flow? Very flow is restrictive? Then they can sustain for another 3-4 years before some intervention can be done. But if it is showing effects on, if it is growing, or if it is showing the effects on the heart, like chamber dilatation, heart is getting enlarged, or patient is getting frequent respiratory tract infections, cold, cough, and he is not gaining weight, then we have to plan exactly what is the way how to treat it. And there are other investigations along with this which has to be done.
So, as per your question, like it is just a small 4 days baby that maybe they must have found it incidentally. So right now there is nothing to worry. Just keep watching on the baby for overall symptoms, as said, the respiratory tract infections, their growth and all. And maybe after a few months we can plan a 2D echo, which will even further give us an idea of how the trend of this defect is going. So there is another user. My 4-month-old was recently diagnosed with a moderate sized ASD during a checkup because of a heart murmur. Should we be worried about any symptoms that may develop, and what signs should we look out for?
What is the age?
4 months.
4 months baby.
4 months baby.
4 months baby, still we can wait for a certain amount of time, like preschool age, for 2 to 3 years. And then suppose if they are not producing any side effects of the heart, on the heart, like heart chamber getting enlarged, or they are not, they are getting some frequent respiratory tract infections. Then they have to plan, depending on the rim of the hole, the ASD, whether intervention can be done in the cath lab or can be taken for surgery. Surgery is also very safe, and even interventions have come which are quite safe to do it.
So this parent was asking about any symptoms that may develop and what signs should we look out for. So like as we discussed just now, so it is the frequency of the respiratory tract infections, especially because when there is an ASD, if it is increasing or the flow is increasing, that may eventually load up the lungs with a little more blood congestion of the lungs. So that in itself will predispose to frequent respiratory tract infections and easy fatigability. So the child, we may see that because it is a 4 months child, sometimes we may see that the child is facing difficulty while feeding or breathing very rapidly, or sometimes in worsened cases there can be some swelling. These are the symptoms that you should keep looking for. But if you don't see any of those symptoms, and if it is, even if it is a moderate sized ASD without any of these symptoms, maybe we can wait. We can wait and watch, and with periodic 2D echoes, that would give us a clearer picture. So along with the child's overall growth, development, and the 2D echo picture will give us a better idea, like whether we can wait further or should we intervene at any point of time. So, one parent, our kid is currently 3.5 years old and had a heart problem since birth, TOF since birth. Initially, an operation was done by BT shunt. He was better for a few months, but again had episodes of blackish blue spells. Currently, doctors are advising for corrective surgery. I am worried because again, will this surgery help, or even this surgery also can show recurrence? What is the life risk? Please give your opinion for our future issues.
See, TOF can be a simple TOF with a good pulmonary arteries size, or they can be associated with a bad pulmonary artery. I think further investigations it will prove with like MRI and other investigations have to be done to see how is the pulmonary arteries and all. If it is a simple TOF, reasonably safe surgery can be done, definitive surgery, and it usually cures the patient.
So basically, previously this child was already some BT shunt was done.
Yeah.
So
initially might be the shunt might have failed, or if the shunt is there, we usually during the definitive surgery we block the shunt or we ligate the shunt so that there will not be any two-way channels.
So basically, this pure blood and the impure blood that gets mixed. So during this definitive surgery, previously there is a connection where the blood flow to the lungs is increased. So that is what you have told as BT shunt. So during this definitive surgery, that shunt can be closed and a definitive surgery will help. And there are many cases that recover relatively, reasonably very good life prolongation and quality of life after this surgery. Yeah. But yeah, as sir said, like whether this surgery is how far this will be successful and how far this will help the child. So few further investigations like cardiac MRI, so MRI to look at the structural these things will give us a better picture. Hello sir, my child is now 3 years old, boy. He was diagnosed with an ASD at birth, but doctor said to wait. Now they are suggesting a procedure, catheter procedure, to close it. Why was it okay to wait until now, and why do we need to close it if my child doesn't seem to have any symptoms now?
See, normally ASD if it is an acyanotic heart disease, that means the blood doesn't really, they are not cyanotic, they don't have blue spells. So, and they can wait for certain time before the intervention can be done. The preschool age, any preschool age, usually the other organs also settle, and then we can do a intervention. Like if the rims of the ASD are good, if the rims of the hole is good, we can definitely finish off in a cath lab with a procedure, with a place, what do you call, the stent in between, and otherwise we can reasonably do a good surgery, and the surgery is fast and efficient and it is safer.
So basically, like she was worried, like before there was no intervention was suggested, but now they were asking for a catheter procedure.
Usually we do a intervention at 3.5 years. Why? Because if it doesn't close by that time, then it usually doesn't close. And second thing, these patients may develop in the later part of the age pulmonary artery hypertension. That means their lungs can be congested, they can become again cyanotic, and the heart, even the lung functions deteriorates. So it is, if we do that intervention at 3.5, 4 years, usually the effects of the hole or mixing of the blood are reduced, and they can have a safe life future.
So usually that is the time till when we can wait and watch, and if it is not resolving by the age of 3.5 years,
it will not resolve.
It may not resolve even further. So it's good even without any further symptoms. So that we should not wait till the child lands up with acute symptoms or sudden severe symptoms.
I told it was stent. It was not. It is not stent. It is device. Device they have to do.
Okay. So a user in Instagram, Sai Kiran, is asking, do we need surgery at the age of 25 years with no symptoms of ASD?
ASD symptoms start usually around 40-45 when the pulmonary artery hypertension starts growing, and it suddenly patient starts deteriorating. So it is better to close at 25 so that the other physiological effects which were due to the ASDs, they will not be visible at 40 years, and they can literally lead a normal life. And why this pulmonary artery hypertension we are afraid of is, they usually, once the pulmonary artery hypertension sets in, then they become cyanotic, and usually they die, then the age is reduced than the normal age. They die faster, around 50, 60, they end their life.
So it is good even if without any symptoms, it is better for us to close at the age of 25. So, so the question, even if without symptoms, if there is a persistent ASD, so definitely it is better to close that ASD at that age, even without symptoms. So there is another user on Instagram asking, like, can a VSD child do running and jogging or other exercises?
VSD usually produces a shunt, which is where initially the shunt is between the left heart and the right heart, that is pure blood to the impure blood. Once he goes to the school age where he starts running, then this may not be, the cardiac output and all may be difficult, he may be feeling congestion and he may be breathless. So it depends upon the size of the ASD also. Very tiny VSD he may not have much symptoms, but otherwise he will have sweating, he will have breathlessness, and he will not be able to perform equally with the other children. So it is better we close the things.
So basically, if the VSD, there is no absolute say that a child with VSD should not run or should not do jogging. It is more like based on the size of the VSD. So if it is a relatively moderate size or even bigger size, so definitely instead of loading the child's heart with more and more workload, so it is better to go for a corrective options or keep monitoring, and whenever necessary correction has to be done. So based on the size of the VSD, one should see whether particular physical activities should be restricted or not, but not for everyone. For small VSDs, so definitely they can go like a normal childhood. They can do all the activities like any other normal child. There is one user in the group asked, our 8-year-old daughter has been diagnosed with a small ASD again. So the doctor said we don't need to do anything, but I'm worried. Could this still cause problems later in her life? It was a small ASD. 8 years ago.
It is not the ASD alone. What is the problem it creates? What is the functional of the ASD? How much shunt it produces and how much damage it does to the heart, like dilatation of the heart. So ECG, X-ray chest shows congestion, and ECG shows some symptom, some other regarding the heart dilatation of the right heart. Then it is better, even though patient is not symptomatic, it is better to close it.
So she was worried, like, could this still cause problems later in her life?
Yeah, because I told you that all these patients, they at one point of age, like 35 to 40, depends upon the individual person, they start developing pulmonary artery hypertension. That means what happens in pulmonary artery hypertension, the heart, if it takes only the pulmonary artery or the right heart takes 1 liter of blood, but the blood coming due to the shunt of, so mixing of blood, it may be 1.5 liter. So it is a load on the lungs. So slowly the lungs is designed to a particular load. So they get damaged. They get damaged and then they get symptoms. They get congestion and they start having symptoms. At that time, it may not be prudent even to operate also, but this which would have been prevented, easily we should have prevented it.
So basically there is still, even if it is a small ASD, still there are chances of symptoms. So it is always better for
doing other investigations and then proceed.
Then proceed. Periodic checkups and monitoring should be necessary. One parent, we recently found out that our newborn has both an ASD and a VSD. Is it common, doctor, to have more than one type of defect? And does this mean my baby is at a higher risk?
Actually, even VSDs can be multiple. Not only ASD, VSDs also can be multiple. So multiple holes are possible. Whenever a congenital defect is found in the heart, usually the doctor has to find out the other abnormalities which the heart has. That is, they are usually associated with VSD or left heart abnormalities. Like outside the heart, also there is a hole which is called as PDA, where the aorta and pulmonary artery has a common connection, which is open, and this also allows the blood to mix here and there. All this, it is possible for a baby who is having a congenital defect to have multiple defects. But how serious they are means how much physiological damage they are producing depends on that. We have to.
So basically, both ASD, that means upper septal defect, and VSD, that is lower septal defect, both combinedly the frequency is relatively less, but it is not uncommon. So we do keep seeing like ASD and VSD both present in the same child. But again, as we discussed before, it is the size and the overall impact based on the pressure changes that's happening. That is what it determines whether the child needs to be intervened or whether we can wait and watch. It's not just because there are two that we should worry. But yeah, as sir said, we should look for other associated abnormalities also. when there is more than one congenital issue that is present. So definitely we should look for any other associated issues, because not just in the heart and just surrounding the heart, even other organs like in the kidneys, in the liver. So to look at any congenital abnormalities, maybe underlying genetic issue which is leading to this developmental issues in the heart. So it's not uncommon, but yeah, it is relatively less frequently seen. So it has to be kept an eye on and it should be monitored. But no need to worry that even ASD, VSD, both present in a same child, they also can lead a normal life. They can go into spontaneous closure without any intervention also. But yeah, frequent monitoring and 5 to 6 monthly 2D echogram should be a useful monitoring.
Useful test, yeah.
Hello sir, my 2-year-old boy has a moderate VSD and we have been managing it without surgery so far. Recently we noticed that he is getting tired more easily, and we also noticed that frequent chest infections in the child, I mean respiratory infections maybe. Could this be related to the VSD or it is a normal childhood infection?
See, if a VSD is present and if the patient is having this tiredness and also respiratory tract infection, usually it is due to the VSD. So VSD has to be taken into account and it has to be thoroughly investigated, and if found better, if it is better to operate that patient and reduce the symptoms of the VSD, because once the lungs get congested, then they start producing symptoms. At one point of time, they stop producing symptoms. At that time, we can't do anything to the baby.
So, these symptoms, like it's not like the cold, cough and cold, or the respiratory tract infections. We cannot just think that like any other child is having. Whenever a child has VSD, definitely we have to keep more watchful on the symptoms, because a normal child may get resolved of the respiratory tract infections relatively easily. But when it comes to a VSD child where their lung pressures are relatively more, where the lungs are relatively more congested, the probability of worsening will be higher. So it is always good for us to keep monitoring, as we discussed earlier also, the frequent cardiac monitoring, their 2D echo and other parameters have to be checked. If they reassure that there is no worsening of the VSD, or even if it is improving, then yeah, we can consider it as a normal respiratory tract infection like in any other child. But yes, we should not ignore even if it is a milder respiratory tract infection, or especially the lower respiratory tract infection, that is lung infections.
Lung infection.
So, hello sir, our child had an ASD which was closed by catheter device at 5 years, and currently he is 6 years. Does he need to take any precautions, and will he need to continue seeing a cardiologist as he grows, because he is not having any symptoms right now?
Catheter breath for ASD.
For ASD.
So generally they become safe and it is better. Occasional checkups with cardiologist is okay for him. Otherwise, generally after ASD device or surgery, they lead a normal life. They usually don't have much problems.
Hello sir, my daughter is 7 years old and she has a small VSD, ventricular septal VSD. The doctor mentioned that there is no immediate risk, but I have heard that these defects can cause problems during pregnancy and when she is an adult. Should we be concerned about that?
Yes, she requires a periodic checkups, and also whenever she undergoes surgeries, she has to take adequate precautions for to preventing the infection spreading into the heart. That is called as infective endocarditis. And when even in pregnancy also, when the blood supply increased because of the baby and hemodynamic changes occurring during pregnancy, the symptoms may increase. So all these things they have to be monitored, and they have to be monitored delivery, monitored control of a gynecologist and a pediatrician, and at any point of the time, if it is required, we have to take intervention.
So basically, if it is a small VSD that which is hemodynamically insignificant, maybe during the pregnancy also it may not have any effect, but because the pregnancy in itself is a hyperdynamic state, because the blood volume of the mother in itself increases because of the baby inside the mother's womb, that may pose an additional load to the heart of the mother. So if the VSD is the ventricular septal defect is small, that may compensate for it easily without any problems. But in case if the VSD is relatively moderate, or if
even the flow is more,
even the flow across the VSD is also more, then she needs to be intervened. But yeah, so for that at this point, because the girl age is 7 years, we need not worry at this point for now. But a periodic checkup regarding the VSD has to be done, and when she is antenatal, that means when she is pregnant, definitely we have to keep this in mind and do a specific 2D echo and all to see how the VSD
she
is.
requires a monitored care of a gynecologist.
Yes. Hello doctors, we have been told our baby has a VSD and that we should wait, but I have heard that VSD will decrease the growth and development. Will this affect his physical and mental development compared to other children? So basically, if again it is the same like as we discussed, it is not just the VSD that we should be worried about. If it is significantly shunting, if the blood supply is coming from the left side to the right side and loading the lungs, and that in itself is decreasing the left side or pure blood supply relatively decreased, child is getting easily exhausted or getting frequent infections, that can decrease the quality of life of the child, and also it may show its own effects on the physical growth and the development of the child. So you need not worry that just because of VSD the growth will be defective and the development will be affected. If the VSD is larger and if it is causing risk, if it is causing significant
increased shunt, what will it happen is it will reduce blood supply to the vital organs of the body. So growth of the general body will be less. Growth retardation will be there, less.
Right.
So definitely growth will affect. So at that time it is better we manage the VSD.
So basically left side of the heart which sends pure blood to all the body parts for their growth and development. Because of this VSD, if it is shunting to the right side of the heart, that is sending the blood to the lungs. So this pure blood that has to go to the all vital organs and help in growth will be decreased. So that will show its impact on overall growth, including the brain also. So overall growth and development of the body, that would hamper. But if the shunt means the bypass or like the blood going from left side or the pure blood mixing with the impure blood directly instead of going to the organs, if it is increased, then definitely it has its impact on growth and development of the child. So again, the frequent checkups with the cardiologist, with the pediatrician for growth and development assessment, and if necessary, when the surgical intervention is necessary with CTVA surgeons, frequent follow-up should be done, and based on overall growth development assessment and the cardiac status, the intervention has to be taken. So, but just having a VSD, you should not worry that the child is abnormal or child may not grow properly. So having a VSD is absolutely normal. If it is small, the chances of spontaneous recovery or spontaneous closure is high, so you need not worry at all. But whenever you find it, so definitely you keep monitoring it, keep watching it on a periodic basis, and take medical care as and when required.
I think overall all this whole measure, they are ASDs, VSDs, these can be managed by simple methods, and even though medical management by observing or interventions or surgeries, they are safely done. So need not worry about it. They can definitely take a medical help.
Usually, how frequently in the adults we come across septal defects as the first time encountering?
In India, because of the poor education status and the poor availability, means the knowledge of the heart and other things, we don't have regular frequent checkups as in the other countries. So definitely sometimes there may be chances that the patients are coming first time to the hospital at 20 years of age and finds an ASD or a VSD. So here we are finding such kind of, because especially they are in village and they are not aware, and medical awareness is very less still in the villages and even in the urban communities. And second thing, even fear. They are also having a fear to see the doctor, because they may tell something and it may be risking their life of the baby or patient.